remember my name. Hello, everyone, and welcome back to this series of videos. My name is Miriam Mutebi, and I'm a member of the Education and Training Committee and the VP East Africa for AORTIC, and I am joined by Nazik Hamad. And if you've been following, which we hope you have, we've been talking a little about the faculty development workshop, and these are the pre-workshop videos that we're hoping that you're going to have some time to watch. We've talked a little about the introduction to what faculty development is and what it involves, and we've talked a little about career development, which was identified as a faculty development, which has been identified as a key need amongst our African faculty in sub-Saharan Africa. And so in the next video, we're going to talk a little about curriculum development and program evaluation. But first, to bring us all up to speed, we want to talk a little about teaching competencies. And keep in mind, when we talk about teaching competencies, it's not just teaching students and residents, but it's also how do you effectively communicate with other healthcare professionals, nursing team, other allied specialities, and also how do you effectively ensure that this message percolates to the public. You can't necessarily use the same doctor or clinician speak that you would use in the context of a hospital, but how do you then ensure that you communicate that effectively to our patients and to the public such that there is understanding? And so part of what we're hoping to do through the course of the training is, one, to help you plan and deliver a learning activity, and again, to hopefully recognize the influence of role modeling and the impact of the formal and the informal curriculum on learners. It's not just, practice what I say, it's more about how do you create a model, or how do you model in such a way that learners are able to pick up on both the mentioned and unmentioned aspects of the curriculum. How do we create or promote a safe learning environment where it's okay to have errors, but those that they're recognized and managed appropriately? And how do we ensure, even while all that is going on, that we're maintaining patient safety as far as where learners are involved? Again, looking at how do we provide feedback to enhance learning and performance? That was identified as a gap that's frequently missing. And so how do we give effective feedback that's not necessarily going to crush the learner, but perhaps encourage them to seek more feedback? Because these are practices and traits that we want to instill in our learners fairly early. And again, using learning, how do we assess and evaluate learners, teachers, and programs in an educationally appropriate manner, not just going with maybe, it feels like a good program, but are there objective steps we could take to actually evaluate these programs, and to also identify the challenges and sources of support for teaching. So not just looking at the challenges, looking at what are the gaps and how can we then fill those out effectively.
Thanks, Miriam. Another important area that has been identified in the needs assessment is curriculum development. And as everyone knows, curriculum is an adaptable and an ever-changing aspect of education. We're hoping that we will be exploring both the formal and the hidden curricula, which has been identified as an important neglected area in how we train our learners, and also learning how you actually end up creating a hidden curriculum that's not accurate, and how they impact learning. You also learn about curriculum integration, which explains how effectively you combine concepts and topics across a range of subject matter areas.
And so as part of one of the, I would say the main aims of the curriculum development are, one, to recognize the components of the current 6-step model for curriculum development, which we'll go into in a bit, but also to identify ways to develop a curriculum that is context relevant and decolonized. Decolonization is one of, these are part of the key concepts that are starting to emerge. And we're hoping that over the course of this training, we do start to have the conversation around that. How do you create curriculum that actually prioritize or address the needs of the population or the environment in which the learner is training to practice in, rather than sort of necessarily importing wholesale maybe strategies that may not necessarily emphasize the priorities on the ground. So just getting a better appreciation of how to navigate that and how to, as we said, the curriculum is a living, breathing thing. How do we create a breathing curriculum that actually addresses in a practical manner the needs of the learners on the ground? And then how do we identify the challenges, but also the resources of support for developing a curriculum?
And one of the, there are several models and ways to develop a curricula, but in medical education, the most popular one has been the 6-step approach by Kern. And these involve problem identification and then the general needs assessment, and then the needs assessment for the learners themselves, creating goals and objectives, and how do you go about that, and which educational strategy or pedagogy that you're going to engage in, and then how do you implement actually and carry out your training, the curriculum, and then how you assess and evaluate the curriculum. So stay tuned for that.
And again, we also want to emphasize the role of educational scholarship, but one might ask, why educational scholarship? And we know that as oncologists, we do have a responsibility to engage in scholarship, and more, and I would say critically, educational scholarship, because it's the foundation to innovate and improve, both in terms of our learning, training, and teaching for our residents. And we know as oncologists, we're obligated to investigate your work. It's important that you're able to step back routinely and audit your practice, look at what am I doing, what is the ultimate impact on my learners, whether it's the learners, what is the impact on my patients, and to sort of go back and constantly iterate to try and find a system that is more effective and delivers the ultimate objectives that you're hoping to achieve. Again, you're looking at how do we make connections, because you don't operate in a vacuum. As an oncologist, you are invariably part of a multidisciplinary team involving other clinicians, other healthcare workers, caregivers, patients always at the center. So how do we ensure that we foster and enhance vibrant connections that ultimately benefit our learners and our patients? And then how do we bridge the gaps between theory and practice? I think in Africa, we've been a little guilty of saying, this is what we've learned in the books, but this is what we practice. So how do we start to narrow the divide between the two, and looking at, yes, we may not necessarily have all the resources different environments have, but even within the limited resources that we have, how do we ensure that we're giving best practice and ensuring that it's always value-based care that we're providing to patients? And then how do we ultimately connect that to education? And so with all these responsibilities, we do need to consider and ponder, and which we're hoping to do over the course of the training, to do a deeper dive into the reasons behind educational scholarship.
And a lot of people ask what educational scholarship, and traditionally we have been defining it as research that's done to improve education. And the classic way has been to look at the boards called the Boyer criteria, or scholarship reconsidered. And there are different types of scholarship. One is the scholarship of discovery, which is traditional research that we see in translational or basic research. And then there's scholarship of integration, working interprofessionally to understand relationships. And this is becoming very important in oncology, especially when we are, talking about psycho-oncology, or working like implementing guidelines in the professional transdisciplinary manner. Scholarship of application, linking scholarship to practice. Again, some of it is like a guideline concordance and the rest. And then the scholarship of teaching, which is studying, teaching, and learning. And this is very important because you one thing about education is that it's not very well studied. So we kind of sometimes repeat the same practices again and again, and we need to actually interrogate that and do some scholarship to continue to adopt what's working and to stop doing what's not working.
And so we also want to look at the ultimate dissemination of the scholarship, because again, unless we're sort of familiar with the maxim publish or perish, but it's our way of how do we then communicate with our peers? How do we ensure that whatever we're studying ultimately percolates down to our learners and to our patients? And so looking at ways around dissemination, whether it's through publishing, whether it's through conference presentations and workshops, maybe looking through engaging policymakers or opinion leaders, and ultimately learning to advocate for some of our findings. And all these ultimately are some of the areas that we will explore in depth in the modules.
And then one area that was also thought to be important is program evaluation. And since as oncologists, we are involved in creating programs, in sustaining programs, we need to make sure that these programs, whether they are for training our residents or for training the public or training our patients, these programs actually work. And that's where program evaluations comes in. So what is it? What is program evaluation? Systematic investigation of the quality of programs. It's done to determine the value and the significance of the program. So it's an iterative process that needs to be done all the time, asking the questions, what, so what, and what now?
And one might ask, so what is the whole point behind this? And I think it's important because program evaluation helps us to drive reforms by finding gaps in the program. As we said, there isn't any perfect program, for instance. So there's always things that could potentially be improved. And so identifying those gaps and helping coming up with new strategies. The strategies may or may not work, but at least we know, even a strategy that doesn't work gives us information about strategies that we shouldn't necessarily repeat because we know it hasn't necessarily worked in this case. And again, it also allows those responsible for the program to improve it. If we just go along and we assume it's perfectly fine, unless we're able to actively, sort of raise an alarm and say, this is not working, can we constantly try and improve on it? Then that ultimately falls through the cracks.
And so when you are evaluating a program, you need to follow certain standards. Not done is like, oh, this is good, this is bad. Any program evaluation has to have utility. So it's valuable in meeting the needs of improving that program. It's feasible. So but it's not a lot of work, but it ends up in the waste basket. It has to increase the effectiveness and the efficiency. There has to be some propriety, which is this has to be fair. It has to be just and accuracy. So the data that you are, or your program evaluation should be dependable and truthful, and it has to be accountable. So you need to document it well and share it with the appropriate stakeholders. And of course, there are many types of program evaluations that we will discuss again in our module. Some of them are outcome-based. You might be familiar with like outcome-based evaluation, impact evaluation, rapid evaluations. There are some newer ways of doing that, such as appreciative evaluation or empowerment evaluations. And why is it important for African oncologists to have a competency in program evaluation is because traditional accreditation, especially of training programs, has it's sometimes difficult to implement. There has been some critique of the traditional accreditation, the way it's carried for example, in high-income countries. And so, but we still need to evaluate our programs. So this is a valuable skill that will help improve the quality and ultimately improve outcomes in education and in patient care. So this is the end of our part of the pre-conference videos. Stay tuned for our next video, which will be tackling leadership and mentoring. So thank you, everyone, and thank you, Miriam.